You know, right now, inside your body, there's this secret conversation happening. It's between two really powerful command centers. Now, you're obviously familiar with the one in your head, but the other one? Well, it might just be running more of the show than you ever imagined. Today, we are diving deep into the incredible hidden link between your brain and your gut.
So to kick things off, a little pop quiz for you. Think about serotonin, the famous feel-good chemical that everyone talks about for happiness and well-being. Where do you think most of it is actually produced? Go ahead, take a guess. If you're pointing to your head, well, he might want to think again.
Yeah, not even close. Get this, over 90% of your body's serotonin is made right in your gut. That's right, the very same place that's digesting your lunch is also cranking out this crucial chemical. This one fact, honestly, it changes everything. And it's the key to understanding this powerful connection we're about to unpack.
So you have to be asking, how on earth can our digestive system have such a massive role in our mood? Well, it's because it is so much more than just a bunch of plumbing. It's a system so incredibly sophisticated that scientists have given it a pretty amazing nickname, your body's second brain.
Okay, so let's get formal for just a second. It's called the enteric nervous system, or ENS, and it is this massive, sprawling network of over 100 million neurons that lines your entire digestive tract. Now, to put that into perspective for you, that is more neurons than you have in your entire spinal cord. That mind-blowing complexity is exactly why it's earned that title of our second brain.
And this second brain has some serious autonomy. I mean, it can manage the entire digestive show, from moving food along, to deciding what nutrients to absorb, to releasing hormones, all on its own. It doesn't need to phone home to the brain in your skull for instructions. It is a completely self-sufficient command center.
Okay, so having two independent brains is cool and all, but it wouldn't be very efficient if they didn't talk to each other, right? Well, they do, and they do it through this incredible high-speed communication network that's running 24/7.
Welcome to the gut-brain axis. And I want you to forget about a simple phone line. This is a bustling, two-way biochemical superhighway. There are messages just zipping back and forth constantly, keeping our two brains locked in a perpetual conversation.
And the traffic on this superhighway, it flows in two directions. We're all pretty familiar with the top-down route. Just think about those butterflies you get in your stomach when you're nervous. That's a classic case of your brain talking to your gut. But it's the bottom-up traffic that is the truly revolutionary part. Signals from your gut are constantly traveling up to your brain, and they're influencing your mood, your emotions, and maybe even your thoughts.
So what exactly are these messages? What's the language they're speaking on this superhighway? Well, it brings us right back to the star of our show from the beginning, serotonin.
It turns out serotonin is one of the main messengers shuttling back and forth. But in the gut, its day job isn't actually about making you feel happy. It's a real workhorse molecule. Its job is to regulate the core mechanics of digestion. How fast things move, how sensitive the intestines are, and what gets secreted.
But what serotonin actually does all depends on where it docks. Think of these receptors as different doors that serotonin has a key to. So for example, when it unlocks the 5-HT3 and 5-HT4 doors, it's basically telling the gut to speed everything up. Different doors, different actions. And this precision becomes absolutely critical, especially when things go wrong.
So what happens when this really elegant communication system breaks down? What happens when the lines get scrambled, say by stress? Well, the result can be chaos. And the classic example of this kind of communication breakdown is irritable bowel syndrome, or IBS.
And let me be clear, this is not a niche problem. IBS is a chronic disorder that affects a staggering 11.2% of people around the globe. That's more than 1 in every 10 people dealing with, essentially, a dropped call on their gut-brain axis.
And this quote from researchers in the World Journal of Gastroenterology just nails it. They say IBS is a combination of an irritable bowel and an irritable brain. It's not just a gut problem, and it's not just a brain problem. It's a problem with the connection between the two. You really can't treat one without thinking about the other.
And wow, does the data back this up. Some studies find that up to 60% of people who go to the doctor for IBS also have a psychological condition, like anxiety or depression. The link is just undeniable. These two systems are deeply, deeply intertwined. So how does a feeling, like stress, actually turn into a physical symptom? Let's walk through the cascade. First, psychological stress triggers the brain. That sends a flood of stress signals down the line, which then activates the gut's own local immune system. And this in turn can mess with the gut lining and disrupt the delicate balance of your microbes, leading directly to those classic, miserable IBS symptoms like pain and cramping.
The consequences of this communication breakdown are very real and very physical. The gut can become hypersensitive, so even normal digestion feels painful. The movement can go haywire, causing awful swings between diarrhea and constipation. And the protective lining of the gut can even become compromised, which just creates a whole new set of problems.
But here's the really helpful part. By understanding this whole system, we can actually find ways to intervene. We can learn to hack the gut-brain axis to restore balance, and that is leading to a completely new way of thinking about treatment.
See, the old approach was so one-dimensional. You have constipation, here's a laxative. It treated the gut like it was an isolated problem. The new approach is totally different. It's multidimensional. It looks at the entire gut-brain axis, recognizing that managing stress is just as crucial as dealing with the physical symptoms down below. And this opens up a whole new toolbox of treatments. Now we've got therapies that target the brain, like cognitive behavioral therapy and even hypnotherapy, right alongside strategies for the gut, like specific diets and probiotics. Plus, we now have powerful medications that can directly target the chemical messengers in this conversation. This is where hacking the system gets really, really specific. Remember those serotonin receptors, the doors? Well, for someone with diarrhea-predominant IBS, doctors can use drugs that block certain doors to tell the gut to slow down. But for constipation, they can use different drugs that activate other doors to speed things up. It's an incredibly precise intervention, right at the level of that biochemical conversation.
So, what is the crucial point here? What's the big takeaway? It's that your gut is not just a digestive tube. It is an intelligent, complex, communicative organ. And that gut feeling you sometimes get, that's not just a cute metaphor. It is a biochemical reality, a real conversation between your two brains that has a profound impact on both your physical and your mental health.
You see, paying attention to your gut health is a form of paying attention to your mental health and vice versa. That conversation is happening 24/7, whether you're listening or not. So the final question I want to leave you with is, what is your gut trying to tell you?